Welcome to Integrity Linguistics Institute.
So, what did the trainer say we have to do?
Well, we've got to look through these case notes, 10 sets in total, and decide which of the patients should be referred to the consultant as a matter of urgency and which can wait.
Oh, right. And did I hear him say there's a limited number you can refer?
Not exactly. He said that we should put them in rank order according to the severity of the symptoms and other factors evident from the case notes. Once we've agreed on our list, we have to go and compare with another pair of trainees.
Okay, let's get started then.
All right. So that was the audio script. Is the audio clear? Were you able to listen to the audio? All right. Okay, so I'll just play the audio once again, and then we will come back to the question. Even before the audio finished, some of you were actually coming with the answers.
So, what did the trainer say we have to do?
Well, we've got to look through these case notes, 10 sets in total, and decide which of the patients should be referred to the consultant as a matter of urgency and which can wait.
Oh, right. And did I hear him say there's a limited number you can refer?
Not exactly. He said that we should put them in rank order according to the severity of the symptoms and other factors evident from the case notes. Once we've agreed on our list, we have to go and compare with another pair of trainees.
Okay, let's get started then.
All right. So that was the... Everyone type your answer in the chat box. It doesn't matter if your answer goes right or wrong. Right. So we have most of you going with answer option B. So that means two answer options have been eliminated. All right. So let's take a look into the question over here. Okay. So as I told you, this is a purpose-based question, right? Which means you have to give importance to the overall picture. Okay. Because purpose basically means identifying the reason why this particular activity is being done. So it is not one specific activity. You have to identify the overall picture. You have to train your mind to catch that information. So visualize. Okay. So if you go through the recorded lectures in the app, you can see that I use a lot of photos, videos, and animations and stuff. The reason why I do that is to give you a visualization practice, because when you are listening, if you are able to visualize the scenario, it is going to be much more easier, right? So for example, you read a novel and the same novel you're watching as a movie. Which do you think is going to be more strongly imprinted into your memory, the novel or the movie? Obviously the movie, right? Because our mind is able to catch visual information much more easily. So that's why in listening and all, if you're able to visualize the concepts, it becomes a little bit more easy. So let's just imagine, okay? Let's just imagine the things over here. So let's just do the keyword analysis. So here you hear two trainee doctors doing an activity at a staff training day. Okay, so a staff training is happening and we are listening to two trainee doctors. Two trainee doctors basically means what? Junior doctors, right? And they are doing an activity. So two junior doctors, they're doing an activity. Now the question, now what is your duty over here? Your duty over here is to identify what does the activity give practice in. So this activity they're doing, okay? This particular activity, what is the reason for this activity? What is the purpose behind this activity? That is what you need to identify. So the purpose of this activity is to give them practice in writing case notes. Okay, so we have patient case notes. So they are junior doctors, okay, and they have to become really good in writing case notes. So this activity is giving them practice. So the purpose of this activity is to make them experts in writing case notes. The second thing over here is prioritizing the patients. Okay, so they will not be dealing with just one single patient, right? When they become doctors, after their internship is over, when they become doctors, they'll be dealing with multiple patients, right? And when multiple patients are there, they have to prioritize the serious patients first. That is, they have to give importance to the most serious patients first, and then the least serious patients, right? That is what we call as prioritizing the patients. Otherwise, the serious patient, if they are, if the token number is 25, and if you're saying, no, 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 I'm going to deal with you after 24 patients, the serious patient will pass away, right? So it is very important, doctors, to have the knowledge to prioritize which patients get the treatment first. So this activity is giving, the purpose of this activity is to make them, very much, what is like, prioritizing the patients. The answer option C is dealing with consultants. Okay, so consultants may be, other specialist doctors and other medical professionals. And again, we have to deal with them in a very professional manner. Okay, they cannot very casually, they cannot very, like casual friends, they cannot deal with other medical consultants and all. There is that proper, very formal, professional way of dealing with the consultants is very, very necessary. So this activity is giving them practice over here. Right. Now, since this particular question, as you can see, the answer options are very, very tiny. So since the answer options are very, very tiny, doing the doing the verb analysis becomes much more easier. Okay. So when it comes to identifying the focus of the question, okay. So first and foremost, you need to identify what is your purpose over here. Okay. So your purpose over here is to identify the purpose of this activity. So one particular activity is being done, and your duty over here is to identify why this activity is being done. Now, there is something called as the verb analysis. Okay, verb analysis basically means identifying the verbs. Okay, identifying the actions. Okay, as I told you in the audio script also, if it is a purpose type question, give importance to action words, that is verbs. So similarly, when it comes to the answer options also, the action words, that is the verbs, are extremely important. Okay, it will help you to identify the answer much more quickly. So what is the action word over here? Writing. Okay, writing is the action word. Over here, it is prioritizing the patients. And over here, it is dealing with consultants. Right. So let's just make this small connection over here. So the purpose of this activity is to give them practice in writing. Here it is to prioritize the patients, and here it is to deal with the consultants. Now, what we just did right now is comprehension of the question. Right? What we did right now is understanding the question, and we did something called as the keyword analysis and the verb analysis. Right. So when you get your question, okay, your listening question, they give you 15 seconds time. So you get 15 seconds time to comprehend the question. Right. So with a very clear, calm mind, you need to read the question. You need to identify, okay, this is a purpose type question. Okay. And these are the keywords and these are the verbs. Okay. The purpose over here is to make them very good in writing. The purpose is to make them very good in prioritizing the patients. The purpose of this practice is to give them knowledge on how to deal with consultants. Right. So like that, you have to comprehend the question. Next is retention of the question. Now what you have to do is, once you have understood, you have to register this entire information to your memory. Right. You have to register this entire thing into your memory. That is what we call as retention. Okay. And why is retention extremely important? Because when the audio is playing, okay, after 15 seconds, when the audio is playing, your eyesight should be only here. Right? Because as I told you, in the audio script, the OET people will definitely, they will try to distract you. Okay, they will try to misguide you. Okay, they are very cunning. Okay, so you should not get distracted. Okay, you should have very clear focus. So when the audio is playing, do not do the mistake of reading the question. Because when the audio is playing, if your eyesight is going to the questions, then you will not be able to eliminate the incorrect answer options over here and also to choose the correct answer. Okay, so that is why retaining the memory of the question is extremely important. Right. So over here, you need to know the memory should be there in your mind. Okay, so I'm listening to two junior doctors. These two junior doctors, they are doing an activity in a staff training day. Right. And my duty over here is to identify what is the purpose of this activity. This memory should be in your mind. Okay, and with this memory only, you have to listen to the audio. So your eyesight should only be in the answer options. Otherwise, you will really struggle. Otherwise, if you're reading the question when the audio is playing, you are going to distract yourself. The OET is trying to distract you. So two distractions together, it is going to amplify, the negative impact. Right. So now we listen to the audio script twice. So now let's take a look into the audio script over here. Right. So let's take the audio script. Now, here the elimination strategy as well as the overall picture. Okay, that will definitely help you out. Right. So let's take a look into the audio script over here. So the first junior doctor is asking a question. So what did the trainer say we have to do? Okay, so remember that these are junior doctors. So they have a superior over there. That is the training doctor, trainer, the person who's giving the training. So the junior doctor is asking, so what did the trainer say we have to do? Okay, so this is what, as I told you, this is a trigger words. Now see, there are two people speaking, right? And as I told you, you should focus on the main speaker. So here, this is the main speaker. Okay, the female over here, she is the main speaker. So the other speaker over here is helping to shape the conversation. So they are also playing a very silent role. That is, they are shaping the conversation. Okay, they are giving certain trigger words so that we are able to identify the tone and attitude of the main speaker. Now you see over here, the very first junior doctor is asking a question. Okay, so what are we supposed to do? What did the senior doctor say to us? So that is a trigger word. Okay, now from the main speaker, you have to give importance to the tone, you have to give importance to the attitude, and also the verbs. Remember, it's a purpose type questions, so you have to give importance to the verbs over here, and the keywords of the answer option should also be thorough in your mind. So let's see what the main speaker is saying. So the main speaker is saying, well, we have got to look through these case notes. Okay, so the first keyword over here is case notes. Now, in which answer option did we read the case notes? In answer option A, right? So in answer option A, the word case notes is coming. So the keyword over there is coming. So now what should you do? Your eyesight. Okay, remember when I told you when you're listening to the audio, you have to listen, you have to look only into the answer options. Now your eyesight should be in answer option A. Okay, you should not be looking into answer option B and answer option C. Your eyesight is in answer option A. Now, what is the action over here? The action over here, the verb over here is writing. Okay, so now you need to identify whether the purpose of this activity is to writing the case note. So writing is not yet mentioned, only case note is mentioned. So now you have to wait. You have to wait and confirm whether writing is being mentioned or not. So your eyesight is in answer option A. Right. So now they are telling, well, we have got to look through these case notes, and there are 10 sets in total, and decide which of the patients should be referred to the consultant as a matter of urgency and which can wait. Now, see over here, now they're talking about patients. Okay, so they're talking about case notes and they're not talking about anything about writing. Now they're telling about deciding which patients should be referred to the consultant. Okay, so here it is both answer option B and answer option C, because answer option B is talking about patients. So now your eyesight should come to patients, right? And when they talk about consultants, then you should go into answer option C as well. So this is how you have to train your eyesight to go from answer options as you listen to the keywords coming from there. Now see over here, what is answer option B? Prioritizing the patients. That is the action over here. Now see over here, they are telling decide which of the patients should be referred. So first they have to look into the case notes, and after they looked into the case notes, they have to take a decision. Okay, and based on what is this decision? Okay, that is the reference, okay, referring of the patients should be based on on the matter of urgency. Okay, that means the most serious patients, the most emergency requiring patients should be referred to the consultants first. Now see, there are 10 patients over here, so we should not patient number 1, patient number 2, that is not the order. Okay, the decision to refer the patients to the consultants is based on matter of urgency. Okay, urgency, emergency. What is that? So that is a keyword for prioritizing the patients. That is, if you have 10 patients, you need to prioritize the patients depending on which patients require emergency treatment and which do not. So which can wait. Wait basically means what? Patients who can wait for maybe 5 minutes, 10 minutes, even 20 minutes. And even if they wait also, nothing bad is going to happen. But for urgency situations, they cannot wait. For them, they need immediate reference. So what you can do? So here they are talking about the patients, and also what is the verb over here? So again, it's the overall message, right? So you're sensing, okay, the word prioritizing. Okay, so the activity over here is about prioritizing the patients. So what you can do is you can put a small question mark over here. Okay, because you suspect that answer option B could be the correct answer. As I told you can interact with the question paper how much ever you want. Right. And answer option A is not the correct answer yet because writing was never mentioned. Right. So again, we have not yet fully finished the audio. So let's see whether C also could be the correct answer option. So C is about dealing. Now see a trigger word. Now see the other speaker. Now see the other speaker is actually helping you. The reason why there are two speakers is the other speaker will give you a trigger word that will help to shape the conversation. Right. So he will ask you a question. Now see the other speaker is saying, oh, right. And did I hear him say that there is a limited number you can refer? Okay, so he's once again asking a question. Okay, so he's asking, so when we are referring patients to the consultants, is there a limited number? That is, can we refer only 5 patients per day? Or can we refer only 10 patients per day? Is there a limit? That 5 patients per limit or 10 patients limit? So he's asking, is there a limit in which on how much patients we can refer to the consultant? Okay, so here they're talking about whom? Now they're talking about the consultants, right? So now the main speaker is saying not exactly. Not exactly means no. There is no limit. You can basically refer how much ever patients you want. Right. Now the main speaker is saying he said that we should put them in rank. Now see once again it is about ranking. Ranking basically means what? First rank, second rank, third rank. Okay, that is you have to prioritize the patients. Okay, put them in rank according to the severity of the symptoms. Now you see over here, once again, urgency, severity. So depending upon the severity of the symptoms, we have to rank the patients. So patient number 10 is the most serious. So patient number 10 will become first rank in terms of referring to the consultant. Okay, and other factors also we have to give importance evident from the case notes. So once again, the message that is being reinforced over here. So see, this person is asking about consultants, but the main speaker is once again taking the focus away from the consultants to the patients. Okay, and that person is saying you have to understand that you have to rank the patients according to severity of the symptoms and other factors involved. And once we have agreed, so once both of them have agreed, okay, so this is the order in which we should refer to the consultant. We have to go and compare with other pair of trainees. So there are other junior doctors over there. Then we have to go and, check with their list as well. So saying, okay, let's get started. Right. Now, the answer option over here is going to be B. Okay. So most of you got it right. Very good. But I want to make sure that if you're going to be choosing B as the correct answer option, you have to be this much thorough. Okay, this much thoroughness and clarity is very important. Don't simply do the guesswork and choose B. Right. And when it comes to eliminating the incorrect answer option, so even if you are a person who struggles with choosing the correct answer, again, in this case, it is slightly challenging. I'm not saying this is a very easy question over here. So here you can focus on eliminating the incorrect answer options. Right. So for example, what is the verb over here? Here it is writing. So even though case note is mentioned, okay, even though case note is mentioned, was this verb over here mentioned? No, it is not mentioned. But what about this word over here? Prioritizing the patients. Don't you think this verb has been mentioned several times, not one time? Okay, that is you have to on the basis of urgency. Okay, you have to rank them according to the severity of the symptoms. Okay, and also take evidence from the case notes. So three times they were talking about the importance of prioritizing the patients before referring them to the consultants. So we can say that this over here is definitely mentioned, the word prioritizing. So from the tone, from the attitude of a speaker, we're able to understand, okay, this is the reason why this activity is being done. This is the purpose of this activity, to know how to prioritize the patients. Right, so that we can see. And when it comes to answer option C over here, it is dealing. Now see, consultants are mentioned, but are they talking about you have to be very polite with consultants? You have to speak very respectfully to the consultants. You must never argue with the consultants. Okay, you have to deal with them in a very kind manner. Are they telling about how to deal with the consultants? No, the dealing part is not mentioned. Right. So the keywords may be mentioned, but the verbs are not mentioned. So writing is not mentioned. Answer option A is eliminated. Dealing is not mentioned. Dealing is eliminated. So if A and C is eliminated, then automatically what will happen? B will become the correct answer. Yes. So this is how you have to refine your elimination skills as well. Right. So let's take a look into the document that I have prepared. And then once we go through that document, once again, we'll be playing this audio so that you get a little bit more clarity. Right. So this is the 25th question. Let's very quickly go through this document. Again, I'll be sharing you with this document to you towards the end of the session so that it'll be helpful for all of you. Right. So what did we discuss right now? We discussed a purpose type question. Right. It was a purpose type question. That is, one task is being done, but you have to identify why this task is being done. Okay, understand the main activity over here. And again, you have to identify the purpose behind the conversation and understand the overall objective. Right. So why does this question belong to this type of category? Because as you can see, there are two trainee doctors. They are discussing what they are supposed to do. Okay, the reason, what is the reason for this activity? So what they are supposed to do in this activity. Okay, so again, the very beginning itself, the trigger words. Okay, so again, the trigger word is coming from the other speaker. That is, what do we have to do? Okay, and this the female doctor is saying we have to look through the case notes and we need to decide. Okay, we need to prioritize patients based on urgency and emergency and see who can wait. Okay, so that is the purpose of this particular activity. So this makes it very clear that the main activity is prioritizing the patients. Okay, and it is not about writing case notes and it is not about dealing with consultants. So the correct answer option will be B, which is to prioritize the patients. So some tips. Okay, so if I'm going to give you some tips for handling such questions, focus on the bigger picture. Okay, again, as I told you, as you're listening to the audio, try to try to visualize and get an idea. Again, you have to sense the bigger picture. Okay, only then you will be getting you'll be able to choose the correct. So writing, again, give importance to the verbs. Okay, if you give importance to the verbs, is it writing or is it dealing or is it prioritizing? So the writing is the bigger picture, dealing with consultants is the bigger picture, and prioritizing the patients is the bigger picture. Now, as you're listening to the audio, you have to sense it. Okay, don't get lost in the small details because the OET is very cunning. And especially when it comes to purpose type questions, give importance to verbs. Okay, verbs in the audio, verbs in the answer options as well. Okay, like decide, we have to decide. Okay, our task over here. Okay, the trainer said. Okay, so these all usually point to the main activity. Okay, and then there are certain distractors over here. As I told you, they talked about case notes, right? Answer option A, they talked. They also talked about answer option C. They also talked about consultants, right? But they are basically distractors. They're just trying to confuse you. So you should have the ability to filter through the distractors. So even though the script is mentioning these keywords, you have to filter them together. Okay, you have to identify that they are basically talking about how to prioritize the patients. Again, everything becomes much more doable if you stay calm. Again, your ability to perform under pressure. I always say this, the OET is not testing whether you know English. They are basically assessing whether you have the ability to perform in a high pressure situation. So stay calm. These questions are not testing your memory. Okay, they are not testing, do you recall every single word that has been said? Okay, but your ability to recognize the goal of the interaction. Okay, so again, you have to refine these skills. Okay, and practice active prediction. So that there is a reason why they give you 15 seconds time. So during the 15 seconds, you have to comprehend the question. Then you have to retain the question to your memory, and you have to anticipate. You have to have a small idea or prediction of what to expect. Okay, so all these are small tips that can help you in handling with purpose type questions. And over here, I have made a list of vocabulary as well. So those who want to recognize, who struggle with synonym recognition and all that, I have made a list of vocabulary over here. So all these things I'll be sharing with you towards the end. Right. So now that is the 25th question. Now let's take a look into the intention type based question. Okay, so we discussed one question over here. Now I think let's go to the intention based question. Let's take that. Okay. Okay, so shall we play the audio once again? Okay, so I think before, it's a very small audio, right? So I think we can play the audio just once again. So listen very actively, eliminate A, C, and choose the correct answer option B, and then we'll go to the 20th next question. 26th session. Okay, so I'll just play the audio once again. Now, as you can see over here, very detailed lectures are available in the app. So with photos, videos, and everything I have, say, as you can see, you have to visualize all these things. That is the reason why very detailed lectures have been given to you. So if you're clever, you will definitely utilize it. All right, so let's take a look into the tense. Now let's hear the audio script.
So, what did the trainer say we have to do?
Well, we've got to look through these case notes, 10 sets in total, and decide which of the patients should be referred to the consultant as a matter of urgency and which can wait.
Oh, right. And did I hear him say there's a limited number you can refer?
Not exactly. He said that we should put them in rank order according to the severity of the symptoms and other factors evident from the case notes. Once we've agreed on our list, we have to go and compare with another pair of trainees.
Okay, let's get started then.
Yes. All right. So it is much more doable, right? It is much more manageable this time. All right. So now let's go and take a look into the 26th question. So this is an intention-based question. Okay. So one activity is being done and you need to identify what is the intention behind the activity. So just give me a second. So I can see the recorded lectures, you can see all these translations over here, explanations over here and all. So that definitely help you out. So those who have clarifications, you can say, and then I give you a reflection moment as well. So obedience is very important. All right. So I'm doing the best I can. You will not be getting this type of coaching anywhere. Ultimately, it is up to you. I don't like spoon feeding students, and I seriously don't like giving, too much of, burdens to students, because I understand all of you are very busy people. But ultimately, that commitment from the students is very important. If commitment is not coming from the student side, then there is not something, that we can do much. All right. So ultimately, the commitment factor should come from you. All right. So let's take a look into the audio script over here. So I think it should be 1 second. Audio script now. Okay. So read the 26th question. Comprehend the question, identify the verbs, retain the memory of the question. When the audio is playing, look only into the answer options and give importance to the tone, the attitude, and try to eliminate the incorrect answer options. Okay, 5 seconds more. All right, so now I'm going to play the audio.
Come in, Mrs. Brown, isn't it? My name's Ted, and I'm going to be doing your MRI scan today. Now, can you get up on the table for me?
I'm really claustrophobic.
Well, this is a new piece of equipment. The diameter is much larger, so it should make it a little more comfortable for you. You'll also have this call bell, so if you need me at any point during the test, you squeeze that, okay?
Okay.
Now, your scan's only going to take about 15 minutes. Are you okay with that?
I am.
Okay, let's get started then.
All right. So that was the audio script. All right. So I'll just play the audio once again. This is a fairly easier question. Audio script. All right. So let's hear the audio script now.
Come in. Mrs. Brown, isn't it? My name's Ted, and I'm going to be doing your MRI scan today. Now, can you get up on the table for me?
I'm really claustrophobic.
Well, this is a new piece of equipment. The diameter is much larger, so it should make it a little more comfortable for you. You'll also have this call bell, so if you need me at any point during the test, you squeeze that, okay?
Okay.
Now, your scan's only going to take about 15 minutes. Are you okay with that?
I am.
Okay, let's get started then.
All right. So what do you think the answer is? Is it answer option A, answer option B, or answer option C? I'll give you 5 seconds time to type your answers in the chat box. Doesn't matter if your answers go wrong. Right. So what is the activity over here? Okay, so here also, again, it is a workplace conversation, right? So remember when I told you that when it comes to listening, listening part B, everything are workplace conversations, right? So over here, you hear a radiographer, okay? So radiographer is working in a hospital or a clinic. A radiographer is talking to a patient. So speaker number 1 is a radiographer. Speaker number 2 is the patient. Okay, so from the patient, so here we can see the main speaker over here is the radiographer, because over here, what is the radiographer doing? That is what you need to have. So this is the main speaker. The other speaker, now remember I told you the other speaker will give you the trigger. Okay, the other speaker is giving you an idea regarding the main focus of the message. Okay, so you have to give importance to both the speakers in that way. So the trigger words come from the patient, but the main message will come from the radiographer. So speaker number 1, radiographer talking to a patient, and what are they talking about? They're talking about an MRI scan. Now, what is your duty here? Your duty over here is to identify what he is doing. Okay, so that is here you have to identify, okay, whether he is clarifying the aim of the procedure, dealing with her particular concerns, or explaining how the equipment works, right? So again, this is once again, an activity is being done, but over here, they're basically asking you what is the intention behind this activity. Okay, that is the intention to clarify the aim of the procedure, is the intention to deal with the concerns of the patient, or is the intention to explain how the equipment is working. Okay, so that we need to decode and find out. Right, so let's comprehend the question. Now, what are the keywords in answer option A? Clarifying the aim of the procedure. So what is the procedure over here? MRI scan. So the MRI is basically the procedure. Right. So the MRI basically has a goal. Okay, there is a goal, there is an objective, there is an aim, there is an ambition, right? And this radiographer is clarifying the aim of the procedure. That is the intention of his activity over here. So what is he trying to do? He is trying to clarify the main goal of the MRI scan. Okay, you have to make the connection. The procedure is basically the MRI scan. So when he's speaking to the patient, he's trying to clarify, no, that is not the aim of the procedure. This is the aim of the procedure. Okay, so he's clarifying. Clarifying basically means what? Clarifying means the patient will say something wrong. Okay, so for example, if you say something wrong, I will clarify it. So no, that is not what is correct. This is the correct information. So that means you can expect. So again, this is what we call as having a small idea of what to expect. So if it is clarifying, that means the speaker number 2, that means the patient will say something wrong. Okay, and then when when the speaker number 1, radiographer, hears it, he's going to clarify that information. So he's going to remove the confusion, and he's going to give the clear message over there. So that is what he is doing, clarifying. And what is he clarifying? Regarding the aim of the procedure. right? So that we have to comprehend like that. Now let's come to answer option B. So what is he doing over here? He is dealing with her particular concerns. Particular. Now see, particular.